Afternoon, welcome to this year's Sustainability Partnerships Awards. Really appreciate everyone turning up. I know it's not always the most attended event of the year because I feel some people are just interested in what's happening and who's being given the awards, but most of the time I think it's generally the people who have submitted some entries. This year, as always, we've had many entries from both businesses and from NHS Trusts. I have had the pleasure of handing those entries over to our esteemed judges and not actually having to do any of the judging myself, but I think that would be a little bit unfair if I did. So happy to have all of our judges on the call today. I'm going to give it a couple of minutes as usual to let people come on. We do have the chat function. We do have the Q&A function. If you want to mention who you are, where you're coming from today, in the chat, feel free to add everything there, add contact details, add anything that you think is relevant for the group. Happy for people to be sharing comments and congratulations throughout there as well. I'm already a couple of minutes past the hour, so the half hour. So I'm going to make a start. This year's awards, as usual, have outdone the previous. The types of entries that we get through, the caliber of not just things like the movement in technology, not just things like innovation, but the amount of people and the amount of interest and the deepening concern that people have for sustainable topics. It shines through every year in all of the entries that we get. So when I said I'm glad that I didn't have to judge them again this year, I really wasn't joking. What we're going to do to make it a good use of everyone's time is I'm going to introduce each of the judges for each of the categories. They're going to introduce themselves and they're going to talk about a little bit about the entries that they went through, and they're going to announce the winner. If you hear your own name as a winner, please, if you can raise your hand in my attendee list, I will then bring you live into the webinar for a couple of minutes to say a few words yourself, and then I'll turn you off as a panelist, and then we'll move on to the next awards. We're going to do the business awards first. And in the interest of time, Richard, I'm going to bring you in. So Richard is our first judge. Richard judged the Carbon Award. So if you want to come in, introduce yourself and give us a bit of insight into what you saw in the entries. You had the most amount of entries this year. You had the most amount to go through. So tell us a little bit about what that was like, and then let us know who you've decided to be the winner this year.
Yeah, hi, thanks, Georgia. And yes, thank you. Thanks very much for the 59-page document. So I'm Richard Hickson. I'm a consultant in anesthesia and critical care medicine. I'm a physician environmentalist with an interest in the ocean. I'm a co-founder of Healthcare Ocean, designer of CPD Match, healthcare advisor to Proteus Ocean Group, which is building the world's first underwater space station off the ocean. And I've worked locally, nationally, and internationally across areas relating to climate, pollution, and nature. And yeah, I mean, just coming to the awards, I mean, thank you for everybody for submitting so many wonderful high quality projects in the category supplier award for carbon. And I must say, I really was truly inspired by the 9 entries, which spanned those 59 pages, A4 pages. The entry I've chosen as the winner articulated a clear strategy describing the development of strong partnerships with measurable outcomes. There was good communication with stakeholders, resulting in educational opportunities and a change in staff attitude towards consumption, resource use, and waste management. The recommendations are easily scalable, can be implemented quickly by healthcare professionals and employing organisations, enabling staff to feel their positively contribution towards solutions and reinforcing the fact that decisions individuals make do matter. Implementing these changes nationally would be a significant step forward toward the NHS becoming a more sustainable service, both environmentally and financially. So the winner I picked for this category is Rufus Henderson, improving recycling rates, reducing costs and carbon emissions in healthcare through the new green 4-stage approach to optimizing waste segregation. So congratulations to Rufus and your team.
Congratulations, Rufus. I am bringing you in as a panelist. I hope that you're ready. Didn't give you much choice on this. I've brought you in. You don't have to go on camera, but would love to hear a few words if you can offer some words.
Um, well, yeah, it's a bit of a shock to be fair. The way you're building up all sounds so good, and I couldn't remember how if my application being as I wish we got used to writing, Richard. That was great. Yeah, thank you very much. Really appreciate it. It was a great project, something we've been working on for a long time. So it's great to see the kind of fruits of the labour. Thank you.
So he said he wasn't expecting it, Richard, but I don't know about you and the rest of the judges. He is quite branded
Oh,
for
I'm just wrapped
for
up for
this
ready for this.
for this webinar. He's got the banner in the background. Yeah. All right, great. I'm going to turn you off from being a panelist. Congratulations. And I didn't mention it before, but we are sending out everyone's trophies in the post, but we do need to get a postal address off everyone. So we're going to email all the winners later today, send you your I'm a winner social media asset for you to share, and we'll send out your completely sustainable trophies out in the post as well once we get everyone's address details. Right. Alexis, I'm going to move very swiftly onto yourself. Alexis doesn't have a camera today, but if you don't know who she is, I mean, I assume everyone on this call knows who she is anyway. So please, Alexis, tell us who you are and what you thought about the entries for the circular economy category this year.
Thank you very much, Georgia. And thank you very much for being let me be judge on such an interesting area to have a look at. So I was looking at circular economy. So just a bit of my background. I'm the Energy and Sustainability Manager with Yorkshire Ambulance Service, and I work nationally and internationally looking at lots of different things, not just with ambulances, but lots of biodiversity, circular economy, and looking across the board at what we can do in order to get to net zero within the NHS, but also health systems and generally across the entire world, essentially. So it was really interesting to have a look at this award, and we had 6 applicants and that were shortlisted. I'm sure there's many more that did very well, but the top 6 were really fascinating to have a read through all the applications. Lots of really interesting work that's going on. And so just so you're not waiting too long to kind of see who the winner is, this application was really fascinating to have a look at, and it was looking at a suitable roadmap to supporting supply chain carbon reductions by looking at segregation, disposal of unused items and high volume items, as well as looking at an insight into the way that other staff interact with resources and where sustainable behaviours might lead to improved resource use and efficiency. So without further ado, I would like to hand over the reins to the winner, Rufus Henderson, again, from New Green, with their 4-stage approach through optimised waste segregation. Well done, Rufus.
Rufus, I've promoted you to a panelist again to come in and say a few words about winning the Circular Economy Award as well. You're absolutely sweeping the board today. And I've been told from Claire that you've just come off paternity leave as well. So this must be a shocking start to coming back into work.
Yeah, it's first full day back in the office, so quite a good one. I guess thank you again. I really should have prepared a speech, yeah, for 2 different ones. It's great. I'd say, yeah, it's been a passion of ours to kind of reduce waste and remove it as much as possible. So it's great to see it being recognised. Thank you.
Thanks so much. I really appreciate it. Right. So I'm going to turn you back into an attendee, hopefully for the last time today. It's not just the Rufus Awards, I don't think. But so everyone is aware, you are obviously allowed to enter more than one category with the same project. None of our judges saw each other's categories. No one has talked about this. This was just such a strong entry for this year. It obviously piqued the interest of both Richard and Alexa. So I thank you both for coming in and judging those. Next up, we've got the MedTech Innovation. We did have a judge, Fanny Burrows. She was judging this one. She sent me over her winner, but she wasn't able to make it for today. So I'm actually going to be the person who is announcing this. This entry did stand head and shoulders above the rest in this. Medtech is something that we are looking a lot more into. There's way more investment going into, but I think that the grit and determination of medtech startups is really important because there's a lot of pitfalls that they have to deal with. There's a lot of strength that they need to get into the NHS, and there's a lot of sort of red tape around what they have to do to be able to become certified and all those types of things. So I've got a lot of time and respect for people who do medtech stuff. So the medtech innovation winner we have for this year are the guys at Beacon Medis for their NHS net zero policy, anaesthetic gases, scope 1 capturing and processing of consumed nitrous oxide. Is there anyone from Beacon on today? Because I don't have an actual name, I just have the company. Paul, is that you? I mean, you put your hand up, so I'm hoping you're from Beacon Medis and you're not just sort of raising your hands in delight around the situation. I'm bringing you in as a panelist. Sorry that it does take a little while for this to come on. Paul, oh, you were on off mute, now you're on mute again. Again, you don't have to feel like you have to come on camera. That's you unmuted. We can't hear from you, Paul, I'm afraid. You might be able to add some comments in the chat, or if there's anyone else from the company that can join. I don't see any other hands. Sorry, Paul, I think that we might have to. Simon. I don't see Simon on my list, I'm afraid. Martin, I'm going to bring you in. Sorry, everyone. It does take a little bit of time with Zoom to bring people in and out, but I do want to make sure that we're giving everyone some time to say some words. Oh, Martin declined being promoted to panelist. I think we're going to have to move on from this one. There might be some time at the end for you guys to come in and have something to say. So thank you so much to Fanny for all her time on this one. I know there's a lot of tech issues at your end. I'm sorry, guys, but thank you so much for your entry. Congratulations on winning. We will send you out your trophy and your social posts and things as well. Okay, so moving on, we have Supplier of the Year. There also is a judge for this called Benan Osman. She also isn't able to join us. So she didn't actually send me over too much information about the Supplier of the Year, but this is a really, really big one for us. It's a really broad one, and it covers all types of businesses who could be supplying into the NHS. And as we know, we've been running sustainability partnerships for almost, 3 years now. We started in 2021, and the variety of different suppliers into the NHS, it's just, the magnitude is absolutely mind-blowing, from everything from estates through to technology through to PPE. It's just it covers so many different industries, and to be winning the Supplier of the Year, the amount of entries that we got for this one is a really big deal. So I'm going to go and just mention who's won that. It's a company called Ozone Health, and their project name was the Dermatologist Will See You Now. Do we have someone in from Ozone Health? Because again, I don't have a name, just the business name. Okay, I've got T Patel, Mr. or Mrs. Patel. I'm going to promote you. Hopefully, we'll be able to hear a little bit more about you. Here we go. Can we see and hear you? Maybe. It's promising. They're in a
Hello?
call. Hello. Hi. Where are you?
I got late. I'm actually in Mumbai.
Oh my
I
God.
was busy
Thanks so much for
traveling and I
joining
thought
us.
I must join in. And here
Well, it's
I
a good
am in
job
the
you
car.
did.
So, but no, this is such a pleasure. So this company, so I'm a dermatologist, and this company was started by a couple of colleagues who I trained with. I joined in sort of a year later. And we've been quietly working in the background, and it's such an honor to be recognized this way. This is one of the first awards we got, and we thought we need to believe on ourselves.
Unbelievable tech issues
So
we're
thank you
having.
so much.
Oh, thank you so much for joining us. I assume it's kind of dark, as it's already nighttime where you are. Sorry, what was your first name? I think we might have cut out, but
And you know, here we are. So thank you.
well, it's always fun to be doing these things online, isn't it? We try and be sustainable by not doing things in person and making people drive all the way. But I've honestly,
So much
that's
panelists.
the first time that I've had someone come in from Mumbai live to take their award. So that's definitely a first for us. That's amazing. Right. Ben Tong isn't here to announce the Software of the Year award. Ben will be joining us later. So what I'm going to do is move into the NHS Awards. So the NHS Awards, we do like to make sure that we have both businesses, both business categories and NHS categories, because we feel that they're quite different in the work that they do. Obviously, the working together, the collaboration, the partnerships and relationships that are formed are really important, but they come from quite different worlds. So we make sure that we have some time to represent not just the businesses who are making a difference to the NHS, but those people, those teams, those trusts that are making a real difference in the work that they do every day. So Ben, you are the first judge for our NHS Awards. Can you please come in, tell us a little bit about yourself and then about the clinical award and some of the entries that you had a look at this year?
Absolutely. Thanks, Georgia. Yes, so I'm Ben Duckworth. I am the commercial director of a business called Green Art. What we do is we help organisations across the UK and wider Europe understand their carbon footprint, develop a net zero strategy to lower that carbon footprint, and then fairly uniquely, we then help procure the projects that actually lower that footprint. Everything from solar to vehicles, charging, biofuel, you name it. We act on behalf of the client to make sure they're protected and they're getting the best possible services and the biggest impact. So I was really, really excited to be asked to judge this award. Generally, it was incredible to see the range of projects that different trusts and parts of the NHS are looking to drive forward, from everything from recycling, changes in consumables, you name it, lots of great entries about lowering, with a requirement to lower carbon. However, the winning entry demonstrated an ambitious aim, a really clear strategy, but also a wide-ranging number of elements to achieve significant decarbonisation, and as often this way is, also cost savings. From showing a hands-on approach and leading the initiative directly, I am delighted to say that the winner is Hussein Abid, and the project was the environmental impact and sustainability of the total hip and knee arthroplasty.
Thanks so much. I don't see Hussein here. Has anyone come in to claim that on his behalf? Anyone want to put their hand up? No. Oh, unfortunately not, Ben. That's a bit of
No problem.
No, I mean, obviously we are recording this and we can send this out and we will get in touch with everyone who's won an award today and make sure that they get to see this back if they weren't here. But that's a bit of a shame, because that was such a lovely intro, and I know that you did get a lot of great entries, and I will continue to say I am not envious at all of the judges this year and what they've had to read through. So thanks so much for all the time and careful thought that you put into that, Ben.
No problem.
We'll probably get you in touch with the individual as well. Maybe if you want to sort of send those thoughts over personally, I'd love to give you that intro as well. All right, we'll have to move on then. Jill.
Oh.
Jill Baker is here to give us her thoughts on the Sustainability Manager or Team of the Year in the NHS. So over to you, Jill. Let us know who you are, first of all, and also a little thought on some of the entries you've had to read through.
Lovely, thank you, Georgia. Yes, I had a Team or Manager of the Year award. I'm Jill Baker, and I work for a company called MJ Medical, and we work very closely with the NHS in the development of projects. And my particular specialism is medical equipment and how that works with a building, because very often we think of trying to make the building very green, and then I come along and throw lots of equipment in and make it very ungreen. So I have a particular interest in the research around the sustainability of medical equipment and how we can develop that further. But reading through all the submissions that we had, it was a really interesting array of submissions that we had, from something quite small in terms of a local project with a primary care team, right through up into the acute setting, where they were tackling, although it was lots of little projects, it all added up to a really big impact within their acute trust. So the team that I have picked had a really good and very clear strategy, and they obviously had the backing of their trust, and they had done quite a lot of investment in terms of software. The other reason I liked it is because it wasn't just suitable for a big acute trust. They had the ability to roll it out then across much smaller projects and much smaller hospital buildings that were within their sort of geographical area. They have looked at £40,000 of savings in this year alone, and they've only been going since January of this year. And they also had a lot of stakeholder buy-in that really showed through in their submission. So the manager and the team of the year that I would like to award this to is Katie Story and their Net Zero Northumbria.
Katie, oh, she is here. I see her. Her name is on the list. Here you go. I'm going to promote you. I hope you're ready, Katie. You're not having your lunch or anything. We're not interrupting your sandwiches. I'm bringing you in. Again, you don't have to go on camera if you don't want to, but please, if you can say a few words, I'd really love to hear from you.
Hello, everyone. Thank you very much. I don't really know what to say, but it's nice to be acknowledged. I think since we launched our Net Zero Northumbria Action Plan in January, we've worked incredibly hard on lots of different things. So yeah, thank you all very much. I'll not say anything else.
Thanks, Katie. I really appreciate it. And look, Katie, listen, I think, Jill, it was you who emailed me who said that it was so inspiring you wanted to share some of the information with your team. Is that right?
Yes, if that would be okay, Katie. We do like a huddle week of training and information and passing on things. And if I can anonymize it, that's fine. But it was just so good reading it. I'd like to talk it through with some of my team, maybe take to some of the tips, and I may well contact you outside of this as well, if that would be okay, and come speak to you and see what you're doing, because it's really interesting.
Yeah, definitely, like, reach out, because there might be other bits and pieces that we can discuss as well. So thank you.
Thank you very much.
That's really kind.
Amazing. Love that outcome. New friendship is born. I'm going to turn you back into an attending.
Hey,
Thanks so much. Have a great week. Thanks for coming on. Jill, thanks so much for that. And thanks again for being the judge for that category. Next up, we have Partnership of the Year. So the Partnership of the Year, again, for me, I think is one that's really, really pertinent, because if the public and the private sector don't work hand in hand, if there's not some collaboration, if there's not some give and take and some genuine push to understand each other's needs as opposed to just pushing your own agenda, then things won't work. You won't get the outcomes, we won't get the inspiration, and we won't get the partnerships that we've seen and that I've seen, and that we've just potentially seen the crucible of one happening with Jill today as well. Luckily we've got Charlotte here. Charlotte, give us an intro to who you are and a little bit about the partnership of the year entries that you've been reading through.
Fantastic. Thank you so much, Georgia. So my name's Charlotte Oakley and I lead on sustainability communications at Beborn Medical, who are a global medical device company. And I've been working on sustainability within the organisation for about 4 years. This is my first time judging, so I'm incredibly grateful to have had the chance to read through all of the inspiring entries for this award. Reviewing the 6 submissions was an absolute pleasure, with each one having a really unique offering that really focused on pairing stewardship of the environment with improving patient and employee outcomes. And kind of as Georgia said, I think we all know how important collaboration is when it comes to sustainability, as we're all learning and sharing knowledge kind of on this journey. And there's so much we can gain from working with others, both inside and outside of our respective industries. So I think considering this, the award winner has been chosen due to its ambitious strategy, and this really required effective management to oversee the 3 interconnected strands of the project and also various stakeholder groups that were involved. The submission details that even though it faced substantial setbacks due to the COVID-19 pandemic, it was able to achieve its objectives with impressive results around improved biodiversity, community engagement and mental well-being, and actually much, much more. So the 2024 NHS Sustainable Partnership Awards goes to the Biophilic Wales Inspiring Spaces Project, Howard Stevens.
Howard, let me see if
Well
you're
done.
on. I don't see Howard. Is there anyone else from that trust or who worked on that project? If you can raise your hand. I don't see anyone. Oh, again, it's such a shame. That was such a great intro. I don't see anyone here claiming that award, I'm afraid, Charlotte. I'm going to have to put you in touch with them, and they'll be able to hear the amazing comments that you've given for that entry as well. Again, a bit of an anticlimax. I was like, yeah, really rooting for them after you did that great speech there for them. But we'll have to just move on.
It was a great submission anyway.
Thanks, Charlotte. Really appreciate it. Really appreciate all your time. And finally, we've got Amy. Amy has been looking at the Sustainability Hero Award. So this again is someone within the NHS, and I won't labour the point too much, but after running sustainability partnerships for nearly 3 years, we've seen genuine tangible change because of individuals. Yes, teams, yes, collaboration, but there's these kind of nodes, these sort of super cheerleaders for sustainability within the NHS that actually make things happen. I've got 2 of them on this call today with Richard and Alexis, and there are far more that I've had the pleasure of meeting over the last 3 years, who are just doing their absolute most and their best and putting all of their energy into things that often aren't even necessarily their remit at work. It's above and beyond, it really is. So I'm glad that we're finishing off with this one, because it's without these heroes, without these people who are genuinely putting their heart and souls into this topic, we wouldn't get as far as we have done, and these issues wouldn't be as high up the agenda. So Amy, I'm going to hand over to you. Sorry, that was a bit of a spiel there. You can go ahead and tell us. Amy's from Medtronic. Give us a little intro to who you are, and also how hard it was to look through the entries for the year, because this is the one that would get to my heart. This is the one that would pull me apart. The entries for the Sustainability Hero this year.
Absolutely. Thanks, Georgia. And yeah, you said it so well. It was amazing to read all the submissions, because it's heartwarming, but also you can see how much effort is going into this agenda, and this is always an on top of for most people in the NHS, and it's great to see the efforts that are going into it. One of the reasons for choosing this, and thankfully you gave me a marking scheme, because there was no ways that I could have chosen one person, but this entry really showed passion to take this forward, be an advocate for environmental sustainability with a measured approach which addressed education, which is super key in engagement for stakeholders, and empowering teams to embed sustainability in what they're doing now, and really try and change that behaviour across all the people that they work with. And that also showed benefits to patients and the hospital system with cost and environmental impact. So the fact that it's measurable really helps with the engagement. So the winner is reducing medicine waste for NBT. So Martina San Clemente here. So it was an honour to read your submission.
Oh, I don't have Martina on the call either. Is there anyone else from that trust or who's coming in her place to receive that award?
Georgia Curran,
Oh, yeah.
nominated. So.
Oh, right, great. Let's bring Georgia in then. Georgia, again, please say a few words. You don't have to come on camera, but we'd love to hear from you.
Might stay off camera actually. Just having my lunch. Yeah, I did nominate Martina. She's one of our sustainable healthcare advocates and in the pharmacy team, and she's always working on sustainable improvement projects at the trust. You can tell she's really got a passion for it, and just goes beyond her day job to really work towards it. So yeah, she'll be really excited about this. So thank you guys so much. Really pleased for her.
Oh, amazing. Thanks so much for putting the entry together for someone else, George. I really appreciate that you sat and spent the time to put her forward. Was there anything in particular that you thought, you know what, I've seen these awards, this woman really deserves some kind of praise, and made you think, I'm going to sit and write up it must have been a great entry as well, Amy, if she's won.
Yeah, so the project she was working on was all about reducing medicine waste by making sure that medicines weren't left on the ward, and instead they were returned to pharmacy so someone else can use them. And yeah, it had loads of financial savings as well as carbon. But we really feel that within our organisation, awards are really key for engaging our staff. And yeah, just shouting about all the great work they're doing really encourages them to carry on doing this. So yeah, it's a really good award scheme that we can get them involved in.
Well, thanks so much for your time and for coming on today. Obviously, send all of our congratulations on to Martina. We potentially will get in touch with you because I think we might just have your email address for her postal address to send the award to, if that's okay.
That's great. Thanks, guys.
All right, lovely. Right, that is the end of the NHS Awards. We do still have the Software Award. I was waiting for Ben Tong to join. He did say he was going to be able to join us this afternoon, but I don't know that he will be able to come, and I don't want to have everyone waiting around. He would be able to give this so much more praise because coming from Ben, software, it's at the heart of what he does, and he won't mind me saying, I do work with him personally on a few different things, and he is the type of guy who really puts his heart and soul into ensuring that the NHS is greener. He's an absolute pioneer into understanding not just how technology can make the NHS greener, but how the NHS can procure greener technology and ensuring that the tech that we're using is fit for purpose. He's absolutely heart and soul, knee deep into these things. So he's really a great judge for this, and he really knows his stuff. Oh my God, here he comes. It's as if by magic. Don't tell him that I said all that great stuff about him. Ben, I was just introducing you. Well, I was just talking about you because you're the last judge to come in, and I was just about to announce your winner for you because we don't have any more awards, and I was just about to do it, and you just came up by magic. Do you want to give an intro to who you are, please, and maybe a little bit about some of the entries that you read through this year?
Yeah. Hi, everybody. My name's Ben Tung. I'm the Greener Digital Lead in NHS England. I head up the digital workstream of the Greener NHS programme, looking at how we can decarbonise and make climate resilient digital healthcare by day job. It was a real honour to have a look at the awards that came in for the Green Software Award in this year's awards, which is a really exciting new topic. It's a really emerging area, so it's great to get an understanding of what some of the people are using software to do in terms of achieving sustainability outcomes. We had some really interesting applications coming in, looking at car parking management systems and how we can start to factor in environmental considerations into how we run those. And there was another really interesting one that was looking at auditing systems and how to make massive improvements in time requirements that go into achieving those outcomes for CQC requirements. Is it time for me to get into the winner? Yeah.
You definitely, you've got a long drum roll happening here, Ben.
Okay,
So yeah,
great.
go ahead and announce who
Yeah.
won.
Yeah, so the winner was a software-led redesign of a clinical pathway for specialist dermatology referrals using patient-centric technology-driven approach to improve service connections. They achieved demonstrable and sustainable gains in efficiency of resource consumption, cost savings, and patient outcomes. So to the tune of 2.5 million in 4 years saved financially, about 24,500 hours of staff time saved, and 1.1 million of travel miles saved. And the winner is Ozone Health Limited.
So you weren't here earlier on, but this entry has already won an award. We're bringing the award winner in. She's in the back of a cab in India, and she is joining us.
Amazing.
I hope I can stay on for longer. Oh, thank you so much. This has been such a great day. And well, technology, I'm here so far away and yet connecting in. But no, it's just the recognition is so important because, like I was saying earlier, that this is a pet project. At the end of it, it's the patient that we wanted was started. And here we are, few years later. So thank you so much for your recognition. And we just hope that we can continue to improve on what we've built. Thank you.
Thanks so much. I bet this was a right surprise. I'm so glad that you were able to join us, though. I really appreciate it. You know, it really doesn't matter where you are. You can always join in. And that's why there's a beauty of doing these kind of things online as well. I know it's lovely to see each other in person, but really appreciate you joining us. I'm going to send you back into an attendee now for the last time.
Yes, thank you.
The final award from this year, and it does seem, you know, so much time and effort and thought and has been put into this. You know, we opened this back in the summertime and we've had entries sort of trickling in since then, so it feels to me like it's been going on for a really long time, and just to give it sort of 40 minutes in at lunchtime in December doesn't really do justice to actually the amount of time and the amazing work that everyone does every day of the year. So it just remains to say just a huge thank you to all of the entries that we got through who have made the lives of our judges quite difficult. I'd like to say a massive thank you to all of our judges, the ones that could be here and the ones that couldn't. So to Richard, Alexis, Fanny, Banan, Ben, other Ben, Jill, Charlotte, and Amy. You guys gave up your time, gave up your thoughts, and like I said, it wouldn't have been an easy thing to do, but luckily you did get a little bit of insight, Jill, that you can take some relationships back with. Luckily, hopefully everyone else took some inspiration and insight through reading all of the amazing entries as well, and it's just a really lovely thing to sort of have to do, really, to read through all of those inspiring entries. This is us clocking off for the year for sustainability partnerships. As I mentioned at the beginning of this session, we have been running this for over three years now. We started in January of 2021, and every single year we learn something. Every month, every week we learn something new, some amazing new technology or something actually that's really simple that companies are implementing and the NHS is adopting. We're learning how teams within the NHS itself are becoming more efficient, how they're adopting new and innovative ways of working, and it really is inspiring, and it's really sort of awe-inspiring, and we should be quite proud. We should be really proud of everything that we do and of the health system that we have in this country. So that's my sort of roundup of the year. A couple of last housekeeping bits. We do still have the Sustainable Suppliers Index, which is on our website. I think one of my team might be sharing that now. Anyone who is interested in becoming a sustainable supplier on that index, please, it's a self-service platform. You just go to that page on the site and you can sign yourselves up. Anyone in the NHS, please again go to that site and start using that as an index of companies that you know will be sustainable. And other than that, it just remains to say thank you again so much to our entries. Thank you to everyone who joined today. Thank you to our judges, and thank you to everyone who's collaborated with us this year. We've done over, I think, 15 webinars this year, and it does take up a lot of your time, but it's absolutely worth it. So this is us for this year. Have a great time off over the festive period, and let's start again with some more fresh ideas and an even greener perspective in the new year. All right, everyone. Thanks for joining.
Thank you.
Thank you.
Thanks, everybody. Have a good day. And a
Thanks,
Merry Christmas.
everyone.
Yeah.
Thanks, guys.
Merry Christmas.
Bye.